my name's Allie. I'm going to be your student nurse today.
Hi.
Can I go ahead and have you tell me your name and date of birth?
Yes, it's Madison Moreland, 11/22/99.
Thank you. I'm just going to go ahead and check your wristband. Perfect. Give you some privacy here. And can you tell me where we are today, Maddie?
Yes, we're at George Fox University.
And what are we here for?
Just a routine physical assessment.
And can you tell me the date today?
Yes, it's April 22nd, 2021.
Awesome. So you are awake, alert, and oriented times 4. How are you feeling today?
Oh, I'm feeling good. Just kind of tired, but
That's good. And any spiritual needs that you need met today through your health care?
no.
Okay. I'm noticing that your mood and affect are matching your responses. Your speech is clear and articulate. We're going to go ahead and move into your assessment today. What brings you in?
I've just been having really bad right knee pain.
Really bad right knee pain. How long ago did that start?
It started about 2 weeks ago.
2 weeks. Okay. And then your right knee, is there a specific spot that it's bothering you?
Yes, it's just kind of on the lateral, like the outside part here.
The outside part? Okay. And then has that been pretty consistent for 2 weeks? Does it come and go?
It's consistent. It does hurt more when I put weight on it though.
Okay. And then how would you describe the pain?
I would say kind of like a sharp
pain. And then does anything make it worse or better?
I've tried icing it and that seems to help.
Okay. Any ibuprofen medication use at all?
I have used ibuprofen once for it and that seemed to help.
That helped? Okay. And then does it radiate through your leg at all?
Not really. It's kind of just in that one spot.
Okay. And the timing's pretty constant?
Yes.
Alrighty. And then on a scale from 1 to 10, 10 being the worst pain, 0 being no pain, where would you rank it?
I would say it's about a 4.
A 4 out of 10? Okay, well we will let the doctor know about that. I'm going to run some quick vitals on you, okay? We'll start with your blood pressure. Okay, I'm going to have you put your arm up on this pillow for me. Just rest it there while we get this on. Thank you. And if you wouldn't mind just holding that for me. Okay. Do you have a normal blood pressure range that you know off the top of your head?
I would say it's usually around like 115/75.
115/75? Okay, perfect. Go. Alright, just a quick squeeze here. Alrighty, 117/83. Looks good. Put that on for you. We can go ahead and move this out of the way. Thank you. I'm going to go ahead and stick this on your finger while I get your pulse and respirations real quick. Raise the bed. All right, your respirations are 12 and your heart rate is 89. Your O2 is 99% on room air. Just grab a quick temperature from you real quick. Okay, 98.9, looks good. Just a couple more quick questions before we get started. What's your career? What do you do for a living?
I'm a nursing student right now.
That's awesome. And then any use of cigarettes, smoking, alcohol?
No.
All right. And what's your caffeine intake look like?
I have about a cup of coffee a day.
Okay. We're gonna go ahead and get started now. I'm gonna start with your heart sounds, so you can go ahead and breathe normally through these. Have you had any chest pain?
No.
Palpitations? And any dizziness with activity or just sitting, anything like that?
No dizziness.
No dizziness, okay. So for these, you can go ahead and breathe normally. I am gonna listen to your carotid arteries up here, and I'll have you hold your breath when I get to those parts, okay? And I'll remind you. Okay, let's go ahead and get started. All right, and if you go ahead and just hold your breath for a quick second. Thank you. I'm gonna go back through one more time, okay? Any dizziness?
No.
Okay. All right. Hold your breath for me one more time. All right. Your S1 and S2 sounds are clear. I'm not hearing any bruise in your carotid artery. I'm just going to check your legs here real quick for any signs of edema. No pitting. Everything looks good there. And then I'm just going to check a few different pulses on you, okay? If I could just have you stick your hands out. Tibial pulse down here, and your dorsalis pedis. I'm looking for amplitude and symmetry. Pulses are strong and equal bilaterally. We're going to move on to your chest and breathing assessment now. Respiratory. Have you had any coughing, sputum, shortness of breath, anything like that?
No.
Okay. Are you feeling dizzy at all from before?
Oh, no. I'm
Okay.
good.
We're going to go ahead and give your lung sounds a listen. Every time I touch my stethoscope to your skin, I'm going to go ahead and have you take a deep breath in and out, okay? Okay. Ready? get the back side real quick. Okay, any dizziness?
No, I'm doing okay.
Okay, same thing back here. Ready? Alright, and then if I could just get you to take a deep breath in for me. Thank you. I don't hear any adventitious lung sounds, no crackles or wheezes. Your lung sounds are clear and equal bilaterally, and your chest expansion is symmetrical. So we're going to go ahead and move into your GI assessment now. If I could go ahead and have you lay down for me real quick. Alright, have you had any changes in your bowel movements lately?
I haven't.
How about passing gas? Is that okay?
Yes.
And then when was your last bowel movement?
It was this morning.
This morning. And what was the color and consistency of that?
It was brown and soft.
Okay, and is that pretty normal for you?
Mm-hmm.
Okay, any nausea, vomiting, changes in appetite?
No, none of those things.
Okay, if you wouldn't mind, I'm just going to have you pull your shirt up for me. Inspect the contour of your stomach. It is flat, looks good, no concerns there. I'm going to go ahead and give your stomach a listen here, okay? You're free to breathe normally. Alright, bowel sounds are normal, active in all 4 quadrants. If you don't mind, I'm going to do some palpation here, okay? Just a warning. Let me know if there's any tenderness. Does that feel okay?
Yep.
Not noticing any rigidity. I'm going to go ahead and palpate your suprapubic area. Not noticing any distension. Alright, I'm going to do some deep palpation here real quick. It's not going to be as comfortable, okay? Let me know if it's tender at all. Feeling okay?
Yep.
Alright. You don't have a catheter. If you had a catheter present, I would be checking for leakage, drainage, and irritation. You can go ahead and sit up now. Thank you. And when was the last time you voided?
I waited about an hour ago.
About an hour ago. And what was the color, clarity, and odor of that?
It was kind of a pale yellow, clear, and I didn't notice an odor.
Okay. And then have you had any urgency or like losing control of your bladder?
No.
None of that. And then any like frequent need to go at night?
No.
No? Okay. Good. So I'm going to go ahead and move into your facial assessment. We're going to do some tests with your eyes, okay?
Okay.
Do you have any sensory deficits, like any hearing problems, smell, taste, vision loss?
No.
Okay.
No changes.
Good. All right, just a quick shine in your eye right here. Just stare at the back of the wall. On the other side real quick. Awesome. Then if you could just follow the end of my pen here. All right, pupils are equal, round, reactive to light, and accommodation. You could just go ahead and smile for me real quick and frown. Facial symmetry is present, looking good. We're gonna go ahead and move into your skin assessment now. I'm gonna go ahead and, well, do you have any itching or irritation, any spots you want me to address today?
No.
Okay. I'm gonna go ahead and palpate for temperature real quick. Alright, skin is warm and dry. I'm going to go ahead and check your skin turgor here. Looks good, nice and hydrated. Capillary refill is less than 1 second, and I'm not noticing any clubbing. I'm not noticing any swelling, bruises, open wounds, no surgical incisions, no rashes. Everything looks good there. I'm going to go ahead and check your kidneys for any tenderness real quick. Okay. Just a quick tap on your back, okay? Let me know if it's tender at all. How was that? No?
That felt fine.
Anything there? Okay. Thank you. And I am noticing that your skin color is consistent with your racial heritage. So we can go ahead and move into your musculoskeletal assessment now. I'm going to go ahead and have you raise your arms up to the side for me against my hand. Just a little bit of pressure here. And then back down. Okay. And then just curl them up. And back down. Looks good. Okay, I'm going to go ahead and have you close your eyes. And when you do, I'm going to touch a couple different places. And I want you to tell me where I'm touching, okay?
Sounds good.
Okay.
Left upper arm. Right elbow. Right hand. Left knee. Right back of my calf. Left toe.
Thank you. Good job. All right, I'm going to go ahead and have you grip my fingers as hard as you can. Perfect. Thank you. Strength is equal bilaterally. Okay, I'm going to go ahead and have you stand up for me, if you don't mind. And if you could just take a few steps forward and then back. Thank you. Go ahead and have a seat. I'm noticing that your gait is normal, you don't have any balance problems, and your lower extremity mobility is good. I'm going to go ahead and have you, I'm going to put my hands under your feet, and if you could just push down against them. Okay. And then back up. Perfect. Thank you. Your mobility and musculoskeletal system all looks good. I'm going to give you a Braden scale score of 23. Your mobility is good, you're able to move around well, your activity is good, you're in school and doing well. I'm not worried about any friction or shear, your skin looks healthy, no moisture. Your nutrition, I have no worries about that. So I'm going to go ahead and give you a score of 23, no concerns there. You follow directions really well, and I'm going to go ahead and let the doctor know that you're ready, and he'll be in a few minutes.
All right. Thank you, Allie.
Thank you.